All right, we're live. Hey, Oklahoma City, it's Dr. B. Here today to talk to you guys about a little bit of women's health stuff. So we'll just jump right into it, make this quick, because this is kind of a very tailored topic. So one thing we haven't talked about previously, we talked about a lot of pelvic floor stuff and some general medical conditions that come along in women's health, but we haven't talked about just general wellness and things that women should be paying attention to as they age. So I wanted to talk about osteoporosis briefly and kind of define that, what we're looking at, how we test that, things that can happen from osteoporosis. So essentially osteoporosis is, osteo means bone and porosis, I don't know what that means, probably means loss of. But essentially what happens as some people age is that they're at a higher risk of having bone loss for a multitude of reasons. And so osteoporosis and osteopenia are two terms that you'll hear thrown around quite a bit in the women's health field and the bone health field. Essentially, osteopenia means thinning of the bone to the point where there's not quite an elevated risk of bone fracture. So the biggest concern we have as we age with bone loss is that our bones will become fragile and fickle, and we bump them, and then we end up with a hip fracture or something of that nature, which makes people immobile. And then over time, that can be the first kind of hit to their health that really sets them towards a decline in their overall wellness. So osteopenia is before you get that increased fracture risk, and then osteoporosis is when your bone density essentially has whittled away to the point where you lack enough healthy bone that it increases your risk for fracture. So things that people see when they have osteopenia or osteoporosis: fracture risk. As you notice, as women get older, because this is more likely to happen in women, about 1 in 4 women over the age of 65 will have osteoporosis. There's about 10 million people in the United States that have osteoporosis, of which 80% of those are female. So this is a very, very problematic area for women, and we'll talk about for many reasons why. So we talked about osteoporosis, osteopenia, what the definitions are. What are the things that we see other than fracture? So if you notice, people, as they age, they hunch over because they get these vertebral, or the disc, not the disc, but the bone in their spine starts to get these micro fractures, and the bones will shrink. And so they'll lose height, they'll lose the ability to hold their chest up, so they kind of slump over. You'll see all these kinds of things. They may end up with other musculoskeletal issues coming, or even nerve issues coming from the fractures in their back. And then the big one, like I mentioned prior, is if somebody falls and has a hip fracture later in their life, that opens them up for a multitude of other ailments. So that's what we see when we have osteopenia. When do we start our osteoporosis? When do we start screening for that? So there's a couple of risk factors that we need to take into consideration. One is gender, so women are at higher risk. 2 is race. White women and Hispanic women are at higher risk than African American women and other ethnicities for osteopenia and bone fractures. Age of menopause, so the longer you're menopausal, the higher your risk of osteoporosis, osteopenia. That's because estrogen is the one hormone, and testosterone on some level, that's why men don't really have the same issues, helps to lay down good, new, healthy bone. When you lose the estrogen, you lose that stimulus that helps the bone to continue to thicken, and when that happens, you start losing bone and you end up fracturing. So that's why postmenopausal women are a lot higher risk. So we talked about what else? Medications. So certain medications can whittle away at your bones. So for younger women, this is things like Depo-Provera. There are a couple of endometriosis medications that can decrease your bone density. The good thing about bone density loss when you're young and when it's medication induced is a lot of times it's 100% reversible once you come off the medication. So just keep that in mind as well. Now, if you're younger and you're on a medication that could increase your risk for bone loss, or you have chronic medical condition like thyroid problems, or you don't get enough calcium or vitamin D to where your body starts leaching it away from your bones in order to support other functions, then maybe, just maybe, you should be screened earlier than your normal counterparts. And that's a discussion that you need to have with your doctor so that you can stratify your risk from low to high regardless of what age you're at. There's also a genetic component to this as well. So how do we screen for osteopenia, osteoporosis? So usually we start at the age of 65. If you're younger than 65 with risk factors, then we can roll that in and screen you a bit earlier. Or if you're on medications that increase your risk, your doctor may screen you earlier than the age of 65. What do? We send you for what's called a DEXA scan, which is essentially a bone density scan. They run you through the x-ray machine. The x-ray machine spits out a measurement or a report. The report tells you what does your bone mass look like compared to somebody of the same age, gender, with normal bone mass. And are you within a certain range or standard deviation of that average? And if you're not within that standard deviation, you're considered abnormal and at higher risk. And then from that, they'll actually calculate what's called a FRAX score, which is your fracture risk. And if your fracture risk is elevated, that helps your practitioner decide how to manage osteoporosis or osteopenia for you. So pretty much the way that I do things, I like to start things more on the supplement side, give people a chance to correct their nutrition, their activity levels, supplement-wise, or their hormone imbalances to try to optimize their bone ability to lay down. So that's things like using calcium at around 1,000 milligrams a day. It really just depends on your age if you need more than that. Your vitamin D, we like to keep vitamin D levels by supplementing at least 5,000 international units a day. Majority of sources will say that you don't need that much, but we find in our clinic setting that tends to help the majority of processes, including osteoporosis and osteopenia. We do a lot of hormone replacement for many women that's involved in osteoporosis, osteopenia management. What else? We tell people to get into weight-bearing exercises. Anytime you put stress on your muscles, those muscles are attached to your bones and they pull on your bones, and that's a stimulus to tell your bones, hey, lay down stronger bone so that we don't snap when this person is doing a bicep curl or standing up from a chair or squatting or whatever it is they're doing. If you fall into that group that's high risk for fracture, we may be needed to be a little bit more aggressive. There are medications, there are oral medications, there are injectable medications that you can use. There are antibodies, or we call monoclonal antibodies, that can work within the bone. There's so many different mechanisms to get the end result that you're looking for, which is a thickening of your bones, that you can really tailor the medical approach to the patient. The key to remember is that no medication is without potential side effects. So everything is a double-edged sword. That's why I tend to lean more towards supplement, nutrition, exercise, metabolism management, and hormone management. If we're still not getting anywhere, nothing's improving, then we jump to the medical management, which is an individual basis depending on the person, and we can go into those in detail with the individual patient. So just remember, bone health is important. Make sure you're getting your vitamin D. Make sure you're getting your calcium. If you're not out in the sun, at least 10 to 15 minutes a day to charge up your vitamin D centers. Try to, but wear your sunscreen to avoid sunburn. If you can't do that, make sure you're getting it in your food. If you can't do that, then supplement it with at least 5,000 international units a day. Calcium, drink your milk. Make sure that you don't have any other, if you are low bone mass, make sure your practitioner checks to make sure that your parathyroid gland is working okay, if there's no other risk or other condition that's causing your body to chew up the bone that you have to support other functions. So that's the quick and dirty about osteopenia, osteoporosis. If you're 65 and older, get your DEXA scan. If you're not, make sure you're exercising, eating right, taking your supplements. If you have any questions, leave them in the comments below. Otherwise, we'll be back in 2 weeks to talk about whatever's next. If you guys have any ideas, please let me know. I'm happy to talk about whatever you'd like. Have a great, Wednesday, and we'll check in a couple weeks. You guys have a good one. Bye.